Welcome to Health is Wealth with Dr. Mike. I'm station manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike. One of your favorite topics to start the show today.
Now let's talk about eating real whole foods, unprocessed foods, because we always speak about coming out of this COVID-19, what we want to see with our patients, what we want to see with our listeners, is we don't want to see other illnesses come. We don't want to see the other illnesses, because I'm looking at the data every single day and I'm seeing some of the other illnesses that are going to come out of this from this quarantine: heart disease, diabetes, congestive heart failure, and really these are going to be really top killers, and we don't want them. And so how we can sort of prevent this is we can make conscious choices. So eating real whole foods, unprocessed foods, and most of us are cooking now, which is great. Our kitchen is getting utilized more now than ever. And this is, of course, the stopping of the consumption of ultra-processed foods that actually suppress the immune system because they're full of sugar, starch, and salty calories. And you want to cut down the sugar and the starch, because the data is clear. Sugar suppresses the immune system and actually worsens the viral infections. And then limit alcohol or stop alcohol. And when I say this, I got some flack when I spoke about this on my Instagram page, and a lot of my patients said, "What do you mean stop alcohol? It's the only thing that's saving me." Well, look, this is what I'm saying. I'm saying if you're drinking hard alcohol on a daily basis, that's actually not a good idea to do right now. Now, if you're having a glass of wine and enjoying it with dinner, I prefer red wine, and I think it has more antioxidants. The key here is, folks, if you're doing something, you want to make sure you're doing something that you're getting benefit. If you're not going to get benefit from it, then there's really no point, so you should consume that food or that alcoholic beverage. So the research states that high antioxidant red wine have a lot of resveratrol and really beneficial heart health properties. So having a glass of wine will not hurt the system, but having too many glasses of something is where. So really, to be very clear, Tina, this is where we want to just use the term as limit. And then we want to focus on flavonoids, bioflavonoids, which have a lot of antiviral properties. Now, we talk about, in the literature, there's a lot of research on quercetin. But guess what? You can't find it anywhere. Maybe now you can. It's coming out. But quercetin is really, it's high in things like dill, onion, oregano, chili peppers, apples, leafy green vegetables, and broccoli.
Okay, I like a lot of those.
Yeah, and so, utilize those in a lot of your dishes and you're good. And then the catechins, Tina, this is the epicatechin gallate, which is in green tea. Now, EGCG is the short term. Now, this is green tea, but do you have to go get the supplement, or can you just take the green tea? And yes, let food be thy medicine and medicine be thy food, right? So, when you want to get some more antiviral, immune-boosting herbs and spices, that's when we really get out the ginger, the garlic. We always speak about turmeric, rosemary, obviously the chili pepper, and oregano. And we want a lot of, and inclusive of that are onions. And we want to encourage a lot of our listeners and our patients to really utilize these for sure. But most importantly, Tina, one of the most important besides, we're going to talk about the vitamin D story in a second, but 60% of our immune system is in our gut. This is why it's critical to focus on gut health right now. So that's why eating poorly, not nutrient-dense foods are going to cause your gut to become leaky, and this is where it's going to be a host of potential invaders. So we want to sort of protect this. And most importantly is taking a probiotic. I love that. I think it's important. But when we start going down the list and we start, I've definitely consulted on a lot of my patients to say, hey, what should I do? How do I keep myself healthy? I love a multivitamin for most people because it has minerals. Multi-mineral supplements are really important. Vitamin C, zinc is extremely important, especially right now, because it's going to attack any viral infection coming in, and then it's going to protect. And then, we talked about quercetin, which is very difficult to have, and then melatonin, and then the vitamin D story, Tina, is really important because amid these crises, when you're having these pandemics, and the research is actually out, is the individuals, I just looked at the data last night really late, I looked at the individuals that got hit by COVID really bad, and you looked at their vitamin D levels, and there was a direct, it was directly in an inverse proportionate level. So meaning that the higher the vitamin D levels in your blood, the better you were off in terms of fending off. And this is for all sorts of viruses. This is not just COVID.
Mm-hmm.
So the lower your vitamin D levels, and we know we're all low. Listen, we're in Canada, we're inside, we don't have sunlight. I don't know anybody that's outside, even when it's 12 degrees in a bikini and basking in the sun between 10:30 and 2 o'clock at the opportune UV lights, and then not wearing any sunscreen or any hats. So that's the key. That's why vitamin D supplementation is extremely crucial. I always discuss this. I think it's important, and I'm going to continually, especially when I saw that research article that came out and talked about exactly what's going on with this viral infection and how our bodies are responding. And so if you want to enhance immune support, 2 key nutrients, N-acetylcysteine, which there's been well-documented research that I looked at that showed that this helps the glutathione, and this will actually help the lung tissue. It's really, really good. And then alpha-lipoic acid is another huge, huge antioxidant. And then in terms of herbal remedies, we talked a little bit about the turmeric and curcumin, and then the angiographisc, which is really good in elderberry. These are really good immune modulators. And then there's astragalus, mushroom extracts from reishi, maitake, and you know, cooking with these mushrooms are probably going to be the best. So you have to go out and get these extracts, because a lot of these herbs, you know, you can get them in you know, you can get them in powder forms, you can get them in and use them in your cooking, and I think that is the most important part. Okay, so if you can encompass this and you can do this, and then of course, you know, where do you get all these things from? You know, and so thankfully to Nature's Emporium, of course, you know, I do my curbside on a weekly, and I like to just get a shout out to Nature's Emporium. Thank you, first of all, for offering curbside. Secondly, they're offering delivery to elderly patients to their home, which is amazing. And they're limiting the exposure of patients. They're really doing their due diligence. And then this is the place, obviously, where you're going to get all your vegetables and your organic produce and all your supplements and herbs that we just spoke about. And, you know, obviously, you know, the local frontliners that work in these stores, we thank you very much, and to doing all, and that's the staff, the frontline grocery workers, and everybody. And of course, York Region is home to 3 of these stores for all our listeners out there, so it's really easy. And just a wholehearted thank you to all our frontline grocery staffers, Nature's Emporium, and every single store out there that's actually supporting and being there for our patients, you know, because it's not allowing us to go hungry, right, Tina?
Absolutely.
Thank you, Tina. We're thrilled to be joined again by Dr. Ken Adams, a medical doctor, a dentist. He's gone through medical school twice. And really, you know, it's an honor to have him on the show, because he's been an expert in the functional medicine space and clinical experience for over 40 years. And, you know, in our last segment, we discussed things like weight loss and the connection. And, of course, you know, with over 40 years of clinical experience, Dr. Ken, there's really no condition that you haven't seen, you know, whether it's hormonal issues, fertility issues, weight loss, thyroid, metabolic syndrome, diabetes, congestive heart failure, the list goes on and on. Welcome back, Dr. Ken Adams. What an honor to have you on the show, a true inspiration to myself and all young physicians and doctors in the functional medicine space. Thank you for coming on the show.
Thank you, Dr. Mike. It's an absolute pleasure to be able to participate on your show. My pleasure, and thank you.
And, you know, Dr. Ken, you know, we spoke last segment, and the things that we discussed, obviously, it was about predominantly showcasing things like your book, which is Weight Loss Explained, which is coming out shortly. When's that coming out, Dr. Ken?
In September.
Okay, well, looking forward to that. And you basically, you know, in our last segment, we wrapped up and we discussed how stress, which, by the way, a lot of our, you know, I think millions of Canadians and people around the world are going through stress right now more than ever, just for the uncertainty and difficulty in these very trying times right now. So stress is an all-time high. But you mentioned the key factor. You know, weight loss is not just, hey, let's go on a diet and try to trim on some excess fat. It's more about, let's look at the different factors. So we talk about the thyroid gland and the cortisol connection, which is crucial. In terms of the testing, just because we weren't able to talk about this in our last segment, could you just discuss about what kind of lab tests would be optimal for this?
One of the problems with thyroid testing is that when people are clinically and physiologically hypothyroid, the tests often are in the normal range. I have many patients who go off their thyroid, or their thyroid dose is reduced, and their TSH goes very high, and the T3, free T4 remain in the normal range. The gold standard that I use is basal body temperature. That when it's been shown that when your thyroid slows down, your mitochondria, the oxygen consumption of the body and the heat production is reduced, and taking a morning temperature after your body has been physically inactive for several hours, your core temperature will be low hypothyroid. And that is sort of one of the main things that I use to diagnose hypothyroidism, because the blood tests often are inconclusive.
That's a good point. I mean, I think right now, you mentioned how the inactivity of the mitochondrial. So just for our listeners out there, the mitochondria are the powerhouse of cells. These are the cells that are involved in energy production. So when these are not effectively working, then your body is not able to sort of produce these energy sources. And if you can't produce these energy sources, then hence why your body temperature will actually drop. And then this is actually what hypothyroid is, in fact, is having that low basal body temperature. So when your body's inactive and then measuring it. So just to really clarify, a lot of patients are on these medications, and then they can be on a synthetic form of T4, but there's an alternative, and I know I practice this way and I have a license to do so. So there's a natural variant called T3, T4, which is a desiccated thyroid hormone, meaning that it's an extraction, and I think it comes from the porcine, and it's an extracted thyroid hormone. Now, Dr. Ken, would you mind talking a little bit about the point on this, desiccated, and why maybe it would be a little bit more beneficial for some individuals?
Well, what we tend to see is a high percentage of individuals who are clinically hypothyroid, for whom the thyroid gland is not functioning and producing proper amounts and needed to be supplemented. When you take T4 and your enzyme systems are not being repaired and regenerated as a result of the mitochondria being slowed down, then your ability to convert T4 into T3 is also slowed down. And so even though the T4 levels are normal, the reverse T3 is elevated, and the biologically active T3 is reduced.
And so the T3 and the reverse, just to be clear, T3 and reverse T3 so for our listeners out there, these are blood levels. You can get them measured. So the TSH is the thyroid stimulating hormone. Okay, so this is where we measure. And then we always look, as physicians, as docs, we always look at free T3, T4. But then what Dr. Ken is saying, Dr. Ken, what you're saying is that it's the reverse T3 and the T3 in terms of what you want to look at, because these are the bioactive forms in the blood. And so reverse T3, Dr. Ken, and T3, don't they compete sort of for binding sites?
Right. Reverse T3 is the mirror image. Because of the stereochemistry of the carbon atom, there's two mirror images of its potential shapes. And reverse T3 is the mirror image. It binds to the T3 thyroid receptor, but blocks it and stops it from the T3 that is there from working. So when your stress and cortisol basically slow the conversion of T4 into T3 and promote an increase in reverse T3. And
wonderful.
When your reverse T3 is going up, your T3 is lower, and there's less there, and it's being blocked from working, so it exacerbates the deficiency.
Yeah, and I love how you mentioned the reverse T3 because this is the key. I mean, reverse T3 is something that's not often tested, and it's not a standard of testing. But I mean, when you're dealing with the functional medicine space, it is probably the gold standard and something that I always test my patients, especially with their thyroid conditions. We always utilize this test because it does give us insight. Wonderful, Dr. Ken. So
I would just like to add one quick point on
yes,
that,
please.
Mike, is that the reverse T3 is normally in the low end of the normal range when things are working well, and when it's elevated, it's still usually in the mid-upper normal range. So you don't have to have an elevated reverse T3 to have excess reverse T3 slowing your metabolism down.
That's a good point. Very good point. Thank you. Thank you, Dr. Ken. Excellent. And so our next point is pretty important. You know, I want to talk about something really crucial right now because some of the research came out recently, especially amid this COVID, is that vitamin D3 levels. Now, whenever there's some kind of pandemic or whenever there's, you know, a flu outbreak, there's correlations between the levels, the blood levels of vitamin D3 of patients and how this level ends up dropping. And that's because, you know, colder climate, living in Canada, being inside and indoors, not getting exposed to sunlight. But obviously you've been testing T3 for a long time, and then, you know, at some point you just stopped because, you know, I think I quoted you. Actually, you said that you've tested patients so many times, including in the summertime, tanned individuals, like even landscapers that have been tanned and out in the sun, and pretty much their vitamin D level has been low. Is that correct, Dr. Ken?
That's right. During the summer, if you're getting a lot of sun, you can cut your dose in half, but you should not stop D3. The sun has to be directly overhead, so it's usually between 10:30 and 2 p.m. that the sun is actually getting, the ultraviolet light is getting through, and you're making D3, making vitamin D3 from the sunlight. So I just tell people to go on D3 universally, though I do sometimes draw the level to show to them that it's low if they question that. It just helps reinforce the importance of taking vitamin D3 for patients by seeing that their levels are low, in fact low. Another key point is that they should be taking at least a minimum of 5,000 to 10,000 per day, depending on if you're 200 pounds plus, you should be taking 10,000. If you're much smaller than 5,000 to 6,000 is adequate.
Yeah, especially during these times. Very good advice. And so, you know, just to clarify, vitamin D controls many factors, including, you know, it helps with heart disease, inflammation, hormones, and weight loss, and not to mention our immune system, because this is actually fundamentally responsible for many immunological factors. Wonderful, Dr. Ken. So my next question and set of questions are regarding heavy metal toxicity. And the reason why I bring this up is obviously, you know, you are a dentist, and currently you're not practicing as a dentist in dentistry, but you are trained as a dentist. You've practiced and as a dentist, and so there's a lot of controversy of mercury fillings, and these are the silver style fillings which have, you know, been the standard in dentistry back in the day. Now, I know myself, I've had silver fillings, and I've had them removed. And just so for our listeners out there, you know, this can be reaping havoc in their body, causing a lot of things from autoimmune disease to chronic fatigue syndrome, if this procedure of removing them, you know, I guess not to mention putting them in, because I believe nobody's putting them in now any longer, but it's more about removing them. So can you give some insight as to, you know, doing this procedure right and in the removal of these mercury fillings?
Certainly. So the number of fillings you have determines how much is going to be leaking out. So someone with 10 fillings has 10 times the amount of mercury leaching into their body as someone with 1 filling. But the a filling that normally will last about 15, 20 years for silver fillings. During that 20-year period, there's only a quarter of a millimeter of wear. So actually, only a tiny fraction of the mercury in the filling is actually being absorbed into the body over 20 years. And in fact, your diet potentially has way more mercury, especially if you're eating tuna or fish or things high up in the food chain, as far as mercury exposure. But when the filling is drilled out, there's really high heat, which basically releases elemental mercury, and there's 10,000 times more mercury released during the removal process than during the entire time it's in your mouth. And that is the greatest risk. So when you have a filling removed, that is actually when you're going to get the major potentially poisoning, and you need to be using rubber dam and isolation techniques and high volume suction. And when I've had my fillings removed, I basically hold my breath. So I will tell the dentist that to drill for like 15, 20 seconds and then give me a break. Because there's a lot of fumes coming off. So actually I will not inhale or breathe while the drilling is going on. Then I will take a break, take a couple breaths, and have my fillings removed intermittently like that. Also, it's important to take a chelating agent to basically absorb any mercury that does get ingested or inhaled during the process of removing it. But dentists who know how to do this will basically use a rubber dam and isolation technique and high volume suction. But the last thing I would just say is it's critical not to swallow anything in your mouth through the rubber dam. Should be suctioned out, and try not to swallow it all during the removal process.
Yes, and that's great advice, Dr. Ken, because I know myself. Obviously, we don't know what we know today, but I remember going through the process of taking out a few of my fillings, and a rubber dam was in place, but it was a difficult process. It was very, very. First of all, it wasn't easy, and you're sitting there for a long time, and you're taking your breaths and slowly. But I do remember there was a lot of debris, and I think the debris is sometimes from the drill, right? That can be that can be
a lot of
problem.
crumbs of silver filling that have a huge surface area, and if you swallow those, you're going to get a huge. It's going to dramatically increase your mercury exposure.
Wonderful. Dr. Ken, listen, a huge wealth of knowledge. I really hope you can come on the show again. Thank you for coming on for the second time. If our listeners want to find you or contact with you, could you just give our listeners a little bit of info where they can reach you at?
Okay, I have a website, AskDrKenAdams.com, where they can ask questions and get answers. And also, if you're interested in booking an appointment to consult with me, my clinic number is 416-633-3905. Thank you so much for having me on your show, Dr. Mike. It's been an absolute pleasure speaking with you.
Thank you, Dr. Ken. And this is Health is Wealth with myself, Dr. Mike, and of course, Tina.
Thanks, Dr. Mike. And just a reminder to our listeners, the diet and lifestyle options discussed today should be reviewed with your own doctor. And if you missed any part of Health is Wealth, go to our website, 1059theregion.com. Thank you for listening.